Vaccination is a simple, safe and effective way of protecting people against harmful diseases before they come into contact with them. Vaccines reduce the risk of people getting a disease by working with the body's natural defences to build protection. By working collaboratively with our partners in health, we have been able to support the successful delivery of both COVID and seasonal flu vaccination programmes. The mobilisation of the Health and Wellbeing Bus has enabled us to offer both opportunistic and targeted COVID vaccinations. Due to the rurality of the East Riding, this has made accessing a COVID vaccination easier, particularly for those hard to reach groups.
Young people face many challenges as they enter into adolescence, which can underpin their reasons to experiment or continue to use substances, such as the environment they live in, curiosity. It can act as a defense mechanism to self-medicate for mental health purposes or pressure from their peers and just the need to fit in. Gambling, gaming, new substances and new issues continue to arise, but our response is to build resilience to harm with an integrated young people service that supports universally with education and prevention in schools, youth provision and for selected groups like those who are LGBT, involved in the criminal justice system or need. The use of social media allows us to target young people and families via the implementation of public campaigns and upskilling partners to promote the universal offer to their own service users. Young people who need more intensive support because they are using substances or developing harmful behaviours are referred to the specialist service, who provide information, harm reduction advice, comprehensive assessments and care plans that offer structured interventions for young people.
Green infrastructure includes not only parks and green spaces, but also features such as street trees, green walls, green roofs and allotments. Supporting and creating opportunities that protect our natural environment, green spaces and improve our existing dull areas across East Riding is critical. Green infrastructure can deliver multiple benefits, including encouraging active travel, improving both physical and mental health, supporting biodiversity and addressing climate change mitigation. Our food environment plays an important role in promoting a healthy lifestyle and weight, but this is complex. Factors such as a person's proximity to food outlets, food advertising, and the type of food available can influence our decisions. Vulnerable groups, including those who are low income, children, young people, and those who are overweight or obese, and certain ethnicity groups are less likely to achieve healthy and balanced diet. Removing advertisements from foods in high fat, salt, and sugars, increasing access to healthy, affordable foods, providing opportunities to grow your own food through green space and allotments can increase both physical and mental health in East Riding residents.
Sexual health clinical and outreach services provide access to information on prevention, testing and treatment for STIs. STIs can be easily diagnosed and treated if caught early, but many have severe consequences if left untreated. Chlamydia is not a severe illness in itself, but can lead to pelvic inflammatory disease and potential infertility. Chlamydia testing coverage and detection rates in the East Riding are among the lowest in England currently. Localised outbreaks of syphilis and gonorrhoea are cause for concern, as is the recent emergence of antibiotic-resistant strains of gonorrhoea. HIV is not the death sentence it once was. Provided it's diagnosed early and effectively treated, patients can lead near normal lives, as with any long-term condition. Modern treatments also suppress the viral load, so it's highly unlikely to be passed on to sexual partners. PrEP medication, which prevents acquisition of HIV, is now routinely available for those at highest risk, though they may need support to access it. The East Riding sees small numbers of new HIV diagnoses, but these are often late diagnoses with other conditions alongside, representing missed opportunities across the healthcare system. Due to perceived stigma and the need for confidentiality, services have traditionally been offered on a walk-in basis with minimal personal information needing to be given in order to access treatment. People also have the choice to attend a service outside their local area. During the COVID pandemic, walk-in services were largely suspended, with the restriction of face-to-face appointments to those most in need and the offer of postal or online testing. It is unlikely there will be a full return to face-to-face clinics, so care is needed to avoid widening inequalities for young people and other vulnerable groups.